Welcome to Alzheimer's Sunrise, lighting the way for patients and caregivers on Legends 100.3, brought to you by Alzheimer's Community Care, providing help and hope for thousands of families for the past 20 years. Here's Mary Barnes, CEO of Alzheimer's Community Care.
Good morning and welcome to Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio 100.3 FM. My name is Karen Gilbert. I am a registered nurse with Alzheimer's Community Care, proud to work as Vice President for Education and Quality Assurance. And we have a very important discussion today. We are speaking with Jacqueline Lopez Devine, who is also a registered nurse, and with Trustbridge Hospice. Jackie brings an extensive background in nursing administration, health policy, clinical informatics, quality improvement, and clinical research to her position as Chief Clinical Officer for Trustbridge. Jackie leads the clinical operations as coach, cheerleader, and change agent. She demonstrates her clinical and management expertise through deployment of clinical leadership teams, which have modernized Trustbridge's processes, and we'll hear about quite a few of those, and has resulted in premium quality care model for patients. And prior to joining Trustbridge in 2006, Jackie held positions as Director of the Medical, Surgical, and Orthopedics Neurology Units at Palms West Hospital, Director of Clinical Informatics at Bethesda Memorial in Florida, and Research Nurse Coordinator for the National Institutes of Neurological Diseases and Stroke at the National Institutes of Health in Bethesda, Maryland. Jackie earned her a Master of Science degree in Nursing and Health Policy at the University of Maryland School of Nursing in Baltimore. Welcome.
Wow, thank you so much, Karen. That's very humbling listening to you say all those wonderful things.
You bring tremendous experience and leadership background to this position, so we will be anxious to hear what you can tell us. One of the things that impresses me so much when I speak with families, there are so many that can benefit with hospice service. We know it because we've worked with these families for so long. And the usual response I hear is, well, my mom is not ready to pass. So there is this misunderstanding that the patient has to be imminently passing away in order to benefit or in order to qualify for the services of hospice. Please
absolutely,
tell
Karen.
us about this.
Thank you so much for inviting us here to help you and to help educate the community on a very important topic. So this is a problem that we see and an opportunity in the community. Oftentimes people just do not want to face the inevitable. And the reality of it is that our benefit, which is a full benefit, it offers physician services, nursing services, social work services, chaplaincy services, the service of an aide to help a patient. That full benefit is not taken advantage of, true, until a few days to a few weeks prior to the patient's passing. And what we see is families saying, you know what, I so wish I would have asked to be referred sooner. So it's a combination of not only educating the community and the patients and the families, but also the physicians. The reality of it is that as a collaborative team between community physicians, between the family and hospice, we can provide such a breadth of services. And again, the beauty of our hospice is we do some really unique things. We've got a robust music therapy program. Did you know, Karen, that music is one of those things that, independent of whether a patient has something like dementia and Alzheimer's, it connects with the brain. We've seen patients who were unable to speak all of a sudden speak through song. Yes. Articulate words through song. And it is like magic to me, but it's the reality of the brain and the human mind.
We use music quite a bit in our day centers, and despite the fact that 75% of the patients attending our specialized day centers are severely cognitively impaired, the music, they do not need the words in writing. It comes back instantly, so we use music a lot.
It's amazing. It's amazing. And then the other unique thing about our program and why families are like, wow, man, this is help that can be offered is our robust volunteer program. Things that could help a spouse of a patient with Alzheimer's just to get to the grocery store, to have somebody, be able to do that service for them, and some other things that the volunteers assist with.
So tell us, in contrast to people thinking that they wouldn't be eligible for this service until literally the very end, what is a typical length of service that a family might benefit from hospice?
So with diagnosis like Alzheimer's, the benefit is for 6 months prognosis. So, it's very likely that we would see an Alzheimer's patient with a physician that's well engaged on what our services are for the full breadth of the benefit. Now, what's unique sometimes, and it's well known in the literature in hospice and palliative care, is that oftentimes patients who are on hospice actually have a slightly longer lifespan than those patients who were not on hospice. So it's not unlikely that we'd see a hospice patient be with us for 6 months or maybe even a little bit longer.
And that's not a rigid end of service time.
Correct.
It can actually extend because no one has that crystal ball to say this person is terminal within 6 months.
Absolutely.
So when we begin again, we'll talk a little bit more about some of these specific benefits that a family can realize.
Karen, if I may clarify
Sure.
something with regards to Alzheimer's is one of those unique diagnoses that it's a disease that you see slow decline. So what we watch are some of the other complexities of the illness, whether it's things like weight loss, whether, maybe the patient has another type of condition, like a heart condition. So there is no like, oh goodness, it's 6 months and that's it, and we got to drop you. We just do a very good and robust job of looking at that entire the complexities of that patient.
Exactly, and many will have a comorbidity
right.
as they move along
right.
Through Alzheimer's. If you're just joining us, this is Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio, 100.3 FM. If you'd like to call us at Alzheimer's Community Care, you can reach us at 561-683-2700 or send us an email to info@alzcare.org. That's ALZCARE.org. And if you do, please tell us you heard us on Legends Radio. Our website is also alzcare.org, ALZCARE.org. And you can actually listen to past discussions we've had here on Legends Radio right through our homepage. And, of course, we can link you with hospice service or answer some of your questions and refer you to the experts. I will tell you a personal experience. My mother had advanced chronic obstructive pulmonary disease, COPD, and she was cognitively intact, but her need was oxygen. And because she was on oxygen 24/7, during the day, if she wanted to leave her apartment, she had to take tanks. Now, at the rate she was using the oxygen, maximum she would get out of a single tank was 4 hours. And so when she would want to go down to the dining room for dinner, she lived in an independent living facility. It was quite a distance on the scooter to get there. Service was very slow. And so she would take 2 tanks. And still was always panicky about running out of oxygen. And I said, well, we can buy you a portable oxygen concentrator. She wouldn't let me do it. I said, okay, you have a condition, you're a chronic obstructive pulmonary disease that would qualify for the service of hospice. And her immediate reaction was, but everyone will think I'm dying. And I said, well, they're very discreet when they come to visit you. And that's not what hospice is about. But I said, there's so much they can do for you, and you could have this small concentrator. And what I'm getting to is quality of life issues. And she listened, and she agreed, and she consulted with hospice, and she absolutely agreed to access the services. And she was given that oxygen concentrator, that portable concentrator. So now instead of 2 big green tanks, she's able to take this small machine that no bigger than her handbag. She does not have to worry about running out of oxygen. She could go to the theater and watch a movie. She could go to dinner. She could teach her knitting class to her friends, which she loved to do twice a week. So to your point earlier that people may actually live longer once they have accessed hospice, I definitely think she did, because it put back so much quality in her life. So can you speak to some of those other resources that hospice can provide?
Absolutely. So you're speaking to the durable medical equipment that we provide and the medical supplies that we provide that are related to the hospice, the terminal diagnosis. And in your mom's case, it had to do with her pulmonary disease. So what we find is everything that we provide and the decisions that we make surrounding the diagnosis are related to the patient's goals of care. So, if you, as your mother met with a social worker and we started to interview and say, what are the things that are important to you? And she would say, I want to get to the grocery store once a month. I want to get to, play bridge with my friends, once every 3 weeks, So we would try to really create a plan that would help her do those things. Maybe they weren't as frequent as she could do them prior to that, but, we would try to figure out, well, what is it that we could do to get her in her scooter as much as possible so that she could socialize as much as she can without, giving up the things that are really important to her. And, the one thing that I will say, I can't stress enough, it's all about the goals of care for us. I mean, that is the key driver, whether it's decisions about, oxygen concentrator. Some families, the patient's perfectly fine saying, I don't need a concentrator. For me, I'm here if my grandkids come to me, and I'd rather be there. This is a safe environment. Versus a patient like your mom who says, you know what, please help me stay as active as I could possibly be. And then, the other responsibility and the reality of it is because, hospice is under the conditions of participation of Medicare is that we continuously look at symptoms, we continuously look at patient condition, and we make decisions every period, certification period, is this patient, eligible? And sometimes, and here's the reality, what people don't know, sometimes patients actually improve to the point where they plateau and we discharge them from the program. But we stay connected.
And they can come back to
Absolutely,
you
we
when
stay
the condition
connected.
changes, and that is so important. This is Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio 100.3 FM. We are Alzheimer's Community Care, and you can reach us at 561-683-2700, or send us an email with your questions at info@alzcare.org, ALZCARE.org. My name is Karen Gilbert, and I am the Vice President for Education and Quality Assurance for Alzheimer's Community Care. And if you call us, please tell us you heard us on Legends Radio, or visit our website, alzcare.org. Again, ALZCARE.org. There's a point you hit on that I think is so critically important, and I hope medicine is going more toward this, especially as we have an aging population and the acuity, the medical needs of our patients become more involved as they get older, and that is how someone wants to live. And I remember, again, I'll go back to my mom when she was really moving along in this disease. I was with her at an appointment where her doctor asked her, how long do you want to live? And that struck me as not the right question. How do you want to live? because she surely would have answered, I want to be able to go to the dining room for dinner. I want to be able to teach my knitting class 2 or 3 times a week. I don't want to be stuck in my apartment by myself. That would have driven probably him to say, then I'd like you to consider calling hospice.
Absolutely.
And so I think this is something that we encourage people to think about for themselves. How do you want to live? What's important to you? And when we have a patient enter our specialized day center, of course, the patients are cognitively impaired. They really can't tell us. We may have to ask the caregiver, in your best estimation, what would your mom have said was a great day? Because that's what they enjoy. That's what we're going to try to recreate. Now, there's another misunderstanding out there that if you do access a hospice, you can no longer get treatments. Could you speak to that, please?
Absolutely, Karen. So at Trustbridge, we're really proud of the fact that we have a complex case management program, which simply means we have a program through our foundation that provides us funding to do some unique medical treatments. Things like, blood transfusions for someone who qualifies still medically, and the blood transfusions help them meet their goals of care. I need to get to a wedding, but I need the energy to get there. We'll do the blood transfusion. Same thing for something like chemotherapy or radiation. We don't stop all treatments. And not all hospices can do that. At Trustbridge, we have a very strong foundation that helps us do those things to meet the patient where they're at, to really get to right down to the goals of care and what is it that you want to do. And then, we'll do everything that we can. It's not curative treatment that we offered. It's true palliative, supportive comfort treatment that we offer.
And sometimes, and that truly is a how do you want to live approach, which is outstanding.
So the other thing, Karen, that we've learned along the way is how to have those conversations with family to get to right to the heart of what you're saying. How you communicate with a patient, with a family to get to the goals of care is truly key. I mean, before where we would look more at the data and the assessment, now we get to really, truly, what's the quality of life? What are the things that are truly important to you at this phase in your life? So our training program has changed significantly, and I think it's really important, and I'd love you to know that Trustbridge, we see ourselves as a leader in hospice and palliative care, because we've learned along the way. We've been in the community almost 40 years.
40 years. I see an anniversary coming.
Yep.
And that's fabulous. And I think, too, that where you can provide certain treatments, if hospice service has, how shall I say, we have many older patients who are on too many medications. And in many cases, I've seen upwards of 14, 15, even close to 20 prescriptions.
Oh, yeah.
And there's a problem with that for many, many patients. They actually have more problems because of this, what we call polypharmacy, which is actually more than, some say more than 4, some say more than 5, but certainly 17, 18, 19 is polypharmacy. So that's where sometimes we see patients actually get better if we stop some of those medications that are producing so many side effects. This is Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio, 100.3 FM. You can reach Alzheimer's Community Care at 561-683-2700 or email us your questions info@alzcare.org, ALZCARE.org. And again, we work extensively with hospice, so one of our core services, in addition to supporting our caregivers with our family nurse consultants and our specialized day centers and case management and the ID locator bracelet, is our ability to link families with the services they need. And when we have, let's say, incentivize someone to actually reach out to hospice, they are very grateful. And I have gotten so many emails and calls saying thank you for pushing me, because we realize now what a benefit there can be from this service.
Well, thank
and
you.
they have signed on. So we're thrilled about that. There is
So I just wanted to, if I may, touch base on the whole polypharmacy issue, because I think it's
huge.
very, very important. So the reality of it is, what we as experts in hospice and palliative care, and our physicians who are all hospice and palliative care specialists certified nationally, is that they do a complete medication reconciliation, and they do counseling and coaching, with the family, with the patient, on, what's the best course of treatment medically, and that does involve medication. And it does sometimes say, it's the reality of someone sitting down and saying, at this point, we're not seeing a benefit from this med, and it's causing you more harm than good. Right. And because most patients nowadays are seen by more than one doctor, you're seeing multiple doctors ordering different meds. Right. And the reality is, hospice provides professional case management services. Our registered nurses are professional case managers, and that is another service. When they do a complete medication reconciliation, and that interdisciplinary group, which that's what we're known for in hospice, interdisciplinary group involving all those people that I mentioned earlier, physician and doctor sit at the table, review these meds, and literally that conversation comes up. How are we going to approach the family? Because what we're seeing is this is causing more harm than good.
This is a 360 view. Right. It's looking at the whole person. And we see that quite a bit. Some of these patients that we help that are on a dozen or more medications, they did come from a variety of physicians, so it's almost as if no one practitioner wants to discontinue any of them. But we have many times heard, it's anecdotal, it's not scientific, but we've had caregivers say, gee, my mom really cleared up when they discontinued half of her medications. And I actually had a patient get out of a wheelchair. And wow. I said to her husband, how did you get her walking again? And I watched her walk, and she didn't need any assistance, no cane, no walker. And he said, well, on the advice of your family nurse consultant, we joined the PACE program, which is another collaborator we have that gives that 360 view for a patient trying to live in the community, although they may be nursing home eligible. And he said they discontinued half of her prescriptions, and within a few weeks, she's out of the wheelchair.
Wow.
So the number of medications that get stacked up is a real concern. But understanding that hospice can actually continue to provide those that are addressing pain, allowing that person to have the day they want to have.
Correct.
That's very important, because many believe they have to abandon all treatment in order to qualify.
And that's just
we
not
need
the
to
case.
get that message out. Now, another wonderful service that you provide is respite, where the patient can be cared for. So, because we're very concerned about our caregivers. They are at great risk. They pour everything they have, often neglecting their own medical needs because of the loved one. So how can the respite opportunity actually help both?
Absolutely. So respite is one of the levels of care that the hospice Medicare benefit provides. And what it is it's 5 days truly of respite, where the loved one the patient can be moved into a facility, skilled nursing facility or one of our own facilities, to receive professional nursing care while the caregiver receives true rest at home. And sometimes, they may need a day, they may need 5 days, but it's every benefit period that we can offer that to the loved one.
Now, Trustbridge is a not-for-profit. Again, 40-year anniversary this year. Congratulations.
Thank you.
And we did discuss that Medicare will cover these services, and often families are concerned. So tell us some other mechanisms to cover hospice service.
Absolutely. So besides Medicare, Karen, we take Medicaid as well as private insurance. But I will say that we're very proud of the fact that we are not-for-profit, and we do provide care to our patients regardless of their ability to pay.
And that's wonderful. So we encourage anyone that's dealing with a diagnosis, either in the neurocognitive realm, Alzheimer's, Lewy body disease, vascular dementia, Huntington's disease. There are numerous irreversible causes for neurocognitive decline, or those dealing with a difficult medical diagnosis. To have that consultation, tell us how they reach you.
Absolutely. So you could reach us on our website, which is www.trustbridge.com for more information. But for more immediate help, just give us a call. Call us at 1-844-422-3648. And if you have any questions at all, please give us a call. We would love to reach out and try to help you with your situation.
And at this phone number, 844-422-3648, you're available 24/7.
We are 24/7.
Fabulous. And again, that website is Trustbridge, one word, trustbridge.com. And also Alzheimer's Community Care. Our family nurse consultants work closely with hospice, and so we can help with that linkage as well. This is Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio 100.3 FM. You can call us at Alzheimer's Community Care at 561-683-2700. Or send your question to us by email, info@alzcare.org, ALZCARE.org. And if you do, please tell us you heard us on Legends Radio. You can also visit our website, alzcare.org, ALZCARE.org. Jackie, thank you so much. This, I think, will dispel a lot of those misconceptions about all that hospice can do. We have seen hospice do amazing things in supporting caregivers and patients. We think it's an absolutely vital service, and we hope those that have any questions or needs will reach out.
Thank you so much for the invitation, Karen, and more importantly, thank you for the partnership. You guys are great partners.
Absolutely. It takes all of us. These families need a safety net around them, and no one organization, none of us can do it by ourselves. So
it takes a village.
Those collaborations, absolutely very important to us. Thank you.
Thank you.
Thanks for listening to Alzheimer's Sunrise, lighting the way for patients and caregivers. To learn more about the help and hope available from Alzheimer's Community Care, call 561-683-2700 or visit alzcare.org. That's ALZcare.org. Tune in next Sunday at 6:30 for another edition of Alzheimer's Sunrise, lighting the way for patients and caregivers right here on Legends 100.3.